The first 2 years after your kid is born is often considered a critical or a golden time where we can potentially identify some serious or critical illnesses that your child may be born with. Yes, I'm Dr. Soumen, a cardiologist from Apollo Hospitals, Hyderabad. And today we'll talk about potentially identifying or trying to find out whether your child is born with a structural defect of the heart. Normally, the number is very low. It's almost around 1% of our kids are born with structural defects of the heart, many of which can be minor and not significant, but some of which can be potentially life-changing or significant to critical illnesses which have to be identified early and to be treated early. Now, how do we go about identifying these? Do we have clues? Yes, we do have clues. Now, there are 3 or 4 important questions you need to ask or pose those questions. Most important first question is your child growing well? Is your child gaining weight? Is your child thriving? So all mean the same, so which means that your child is, as compared to his peers, do you see your child gaining weight and showing interest in food? If not, then there is a potential problem. Not all of them may be related to heart, but yes, it could be related to cardiac illnesses. Second, is your child, when he's very young, stops suddenly while sucking milk from his mother while lactating, child just stops, becomes disinterested or starts sweating, gets drenched in sweat and suddenly discontinues taking breast milk, or finds it very difficult to feed on breast milk and there is an interrupted feeding in breast milk, or child is rather short of breath while doing so. That is second thing. Third, is your child intermittently getting blue, especially when child plays, or in winter seasons, or when there are extremes of temperature, cold temperatures, the child getting blue. So you can see blue tinges in the tip of your child's lips or the fingertips or child's tongue. If your child tends to get blue, then you got to understand that there is a potential problem which needs to be, that is rather a specific symptom for a cardiac illness. And fourth, is your child frequently getting ill with pneumonias or lower respiratory tract illnesses? Now, if your child is getting rather frequently falling ill with a pneumonia or a lower respiratory tract illness, बार बार उसको अस्पताल ले जाना पड़ता है, वहाँ पे उसको pneumonia से diagnose किया जाता है, उसका weight नहीं gain हो पाता, वो breastfeed नहीं कर पाता, if he gets starts sweating during breastfeed, and does he get blue? These are a few symptoms or signs that you can pick up in the first couple of years that your child potentially points at a cardiac illness. Now, why is it important? The importance lies that in the fact that some illnesses, especially जहाँ पे हार्ट में छेद होता है और there is a very high flow towards the lungs में बहुत ज़्यादा अगर blood flow हो, क्योंकि कुछ ऐसे कंडीशंस में ब्लड फ्लो बहुत ज़्यादा होता है, अगर उनको 2 सालों के अंदर या 2-2.5 सालों के अंदर आइडेंटिफाई नहीं किया जाता, दे आर नॉट एड्रेस्ड और दे आर नॉट आइडेंटिफाइड अर्ली इनफ, देन इट बिकम्स अ सॉर्ट ऑफ एन इरिवर्सिबल प्रॉब्लम. उसको बाद में उसको आइडेंटिफाई कर भी लिया जाए, then the surgical correction or surgical remedy either may not be possible, or after the surgical correction the child may either deteriorate and may lose his life, or if not, even after a surgery the child may continue to have a poor quality of life and eventually may have a short lifespan. These are a few reasons why we need to be a little careful and vigilant about the child's growth, the symptoms that I pointed out, and scrutinizing about the child's overall well-being in the first couple of years. If you find, आपको अगर ऐसा लगता है कि इन चारों symptoms में से कोई भी एक चीज़ आपके child में है, या नीला पड़ना, या फिर ग्रोथ कम होना, ब्रेस्ट मिल्क ठीक से ना ले पाना, या फिर बार बार निमोनिया को होना, तो ये ज़रूरी है कि इट्स वेरी एसेंशियल और क्रिटिकल टू यू गो टू योर फिजिशियन, स्पेशली कार्डियोलॉजिस्ट. एक अच्छे सेंटर में जाए जहाँ पे इको हो सकता है, स्ट्रक्चरल असेसमेंट हो सकती है, एंड गेट योर चाइल्ड एग्जामिन्ड एंड इन्वेस्टिगेटेड, वेयर दीज थिंग्स कैन बी ईजिली पिक्ड अप. Once you have the diagnosis in time, अगर आपके पास दिशा है, diagnosis है, then a potential surgery can save your child's life and fix his life. उसकी lifelong it can be a boon for him.